Follow and subscribe Stenolab India for correct pronunciation, accurate speed and clear voice. AIIMS and SSC Dictation 800 words. Exercise number 7. Speed 80 words per minute. Start. The Union Budget of India for the financial year 2025-26 has once again brought the healthcare sector into sharp focus, highlighting both the achievements of recent years and the challenges that lie ahead. The Ministry of Health and Family Welfare has been allocated nearly 99,859 crore rupees, which represents an increase of about 11% over the previous year's revised estimates. This amount accounts for nearly 1.97% of the total union budget, a modest improvement but still below the desired threshold of 2%. The National Health Policy of 2017 had set an ambitious goal of raising public health spending to 2.5% of GDP by 2025, but the current allocation shows that the country has not yet achieved that milestone. Nonetheless, the steady rise in health expenditure points toward a consistent recognition of healthcare as an essential pillar of national development, with the government signaling that it intends to continue investing in infrastructure, services, and research. A closer look at the composition of this allocation shows that the Department of Health and Family Welfare received the lion's share, amounting to nearly 95,958 crore rupees, while the Department of Health Research was granted about 3,901 crore rupees, marking a 15% increase. The largest program under this ministry continues to be the National Health Mission, which was allotted more than 37,000 crore rupees, accounting for almost 37% of the overall health budget. This reflects a strong emphasis on strengthening primary and secondary healthcare delivery across rural and urban India. Autonomous institutions such as the All India Institute of Medical Sciences, the National Institute of Mental Health and Neurosciences, and other centrally funded medical bodies received more than 20,000 crore rupees, which is about 1/5 of the total allocation. Another significant component is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which saw its budget raised to 9,406 crore rupees, a jump of nearly 24% over the previous year, underscoring the priority placed on insurance-based health coverage for millions of poor and vulnerable families. Equally noteworthy is the allocation of funds for health infrastructure, research, and disease control. The Ayushman Bharat Health Infrastructure Mission was granted over 5,100 crore rupees, representing a rise of more than 40%, which demonstrates the government's commitment to improving laboratories, diagnostic facilities, and public health preparedness. Around 3,443 crore rupees has been provided for AIDS and sexually transmitted disease control programs, while the Indian Council of Medical Research has been allotted 3,126 crore rupees to continue advancing biomedical studies and clinical innovations. The central government health scheme has received over 2,300 crore rupees, serving government employees and pensioners, while the Pradhan Mantri Swasthya Suraksha Yojana received a boost of nearly 27% to 2,200 crore rupees, aimed at correcting regional imbalances in the availability of tertiary health care. The most striking increase, however, came in the category of human resources for health and medical education, which saw an unprecedented rise of nearly 190%, bringing its budget to 1,675 crore rupees. This reflects a deliberate push to expand the pool of trained doctors, nurses, paramedics, and other allied professionals. Several forward-looking initiatives announced in this budget reveal the government's intention to address emerging challenges in a systematic way. One of the most important announcements was the decision to add 10,000 new medical seats in the current year, with a longer-term goal of creating 75,000 seats over the next 5 years. This is expected to bridge the acute shortage of healthcare professionals and enhance the availability of quality services in underserved areas. Another notable measure is the plan to establish daycare cancer centers in all district hospitals, with around 200 centers expected to come up in 2025 to 26. This is a timely response to the growing burden of non-communicable diseases, such as cancer, which require accessible and affordable treatment facilities. The budget also included measures such as customs duty relief on essential medicines and medical devices, as well as tax incentives for pharmaceutical research and life sciences designed to reduce costs for patients while fostering a more competitive and self-reliant healthcare industry. Despite these promising developments, challenges remain in translating budgetary allocations into tangible outcomes. Public expenditure on health continues to lag behind international standards, with India still spending less than 2% of its GDP on healthcare. Although insurance schemes like Ayushman Bharat have successfully reduced out-of-pocket expenditure for millions of families from 62% of total health spending to around 38%, the reliance on an insurance-driven model raises concerns about whether adequate resources are being directed toward strengthening government-run primary and preventive care facilities. Many rural regions still struggle with shortages of doctors, nurses, medicines, and diagnostic tools despite rising allocations. Furthermore, the ambitious plans for expanding medical education and setting up cancer treatment centers will require seamless implementation, strong coordination between central and state governments, and effective monitoring to ensure that funds are not underutilized or misallocated. Stop.